Mhm.
Good evening, everybody. My name is Mary Akerst, and I'm with Team Catalyst in Minnesota. And this third Thursday Learn More session is about mental health. This is the month of May, and it's all about mental health this month. And today we have our speaker, Robin Andreas, with us. She is a nurse. She's been practicing her nurse uh, experience for over 30 years in a variety of ways in her community. She has a wealth of information. She's also a minister with Lost Sheep Ministries, so works with a lot of people that are going through different mental health challenges. And tonight, what we wanted to do is let her just talk about what is mental health, what is she seen in the community, and some solutions that she might be able to express to us. And then after, we'll pause the recording and then we'll answer questions and answers. So go ahead, Robin. Thank you for your time tonight.
Well, it's great to be here. And actually, it's 46 years I've been a nurse.
Yeah,
And we've been doing
wonderful.
this for about 4 years now, walking with the Lost Sheep Ministry. And so it's an honor to be here tonight and share a little bit of just some of the things that God has shown me and with my own health, with my family's health and my patients' health, and now in our work that we do with the Lost Sheep. So when we talk about mental health and mental health illness type of situations, it's such a broad topic. And there's many things that we can cover, but if we just touch a little bit on some of these things and some of the things that can make a difference in dealing with these kind of situations, it can bring up for all of us maybe the thought about how to go forward when you are dealing with it yourself or a loved one. So when you think about mental health disorders, there's just a wide range of mental health conditions, and we know that, which include like anxiety and depression and schizophrenia, eating disorders, and also actually addictive behaviors is, part of that whole thing. In looking at this talk for tonight, one of the things that we talked about was talking about the mind and the body and the spirit and how all of those things make a difference in our health and our well-being. And so, mental illness, the causes can be inherited. There can be a genetic disposal to it. If we have had family members that have had mental health type of situations, and also, there can have exposure at birth or even while you're still in the womb if there's been drug exposure, alcohol, toxins while you're before you're born, it can be linked to mental health illness. And another thing to consider too is the brain chemistry. We have neurotransmitters that are naturally occurring in our brain chemicals, and it carries signals to other parts of our body and our brain. And so when these neural networks involve those chemicals are impaired, the function of our nerves and our receptors and our nerve systems change, leading to depression and other types of emotional disorders. So, you think about the risk factors that a person can go through. And if there's a history, like I said, of a blood relative or a parent or a sibling, can make you more prone to it. Stressful situations can bring on a mental health crisis or illness. When you think about stress in our life with financial problems, or maybe you've lost a loved one, or you have an issue with one of your kids, ongoing chronic medical conditions can make a big difference, such as diabetes. And when a person has a brain injury, a traumatic brain injury, that can also bring on a mental health condition, um, childhood history of abuse and neglect. And some of these things I think of my own family and how I've watched how that has manifested and come about. The use of alcohol and recreational drugs. And, if a person doesn't really have a very supportive friends and family around them, sometimes just the lack of that can lead to it. And then previous mental illness. I mean, a history of mental illness can kind of wax and wane. One of the things when I do my studies is I check into there's 1 in 5 adults that have mental health issues or mental illness. And so, it's anywhere from very minor things to just the extreme. And so, and it can be temporary or long lasting. And so that can make it a challenge. And when you think about how it can lead us to ongoing depression and substance abuse. Looking at the symptoms of mental health illness and how it can vary depending on what kind of situation you're dealing with. From anywhere from just feeling down and sad to inability to concentrate or even function on a daily basis. With changes in your mood and the highs and lows that come with that. And oftentimes when we're depressed or we're anxious or we're struggling and we don't feel like we're on the top of our game, we tend to isolate ourselves from others. We pull back from activities or even being a part of things with friends and family, and then beyond that. And then it affects just our whole physical well-being, the tiredness that can come with it, the inability to sleep properly, just your activity and your low energy. And then, sometimes it can get as extreme as keeping us from the reality of things, becoming paranoid. And sometimes it can lead to hallucinations and paranoia. And then just not coping with your stress, daily problems. Trouble understanding and relating to people and situations. Problems, like I said, with drug and alcohol use. Major changes in our eating habits. So some people can overeat when they're dealing with these types of things, and sometimes people don't eat at all, and they struggle and they lose a lot of weight. It can change our sex drive, and when we're anxious or we're depressed, sometimes it can bring on some real anger and hostility and violence. And then ultimately, which is something that we want to make sure we get right on top of, is the suicidal thinking and ideation, and then people wanting to follow through with that, having a plan. But the other thing is physical symptoms that can come on. Sometimes we don't even realize that we're struggling with maybe a mental health issue, but we have maybe a backache or a stomach ache or bad headaches or these unexplained aches and pains, which can be another symptom and can vary, from time to time. Looking at some of the complications that can occur that lead to things, there, can lead to a disability. And I know in my own family, that's happened with one of our children where, it was a situation where it got so bad that one of our children couldn't even work, couldn't even get out of the house, couldn't even just take the simple steps of daily, what's considered kind of normal or regular in somebody's life. So it causes us a lot of emotions, and a lot of behavioral and physical health problems occur. And it leads to a lot of family conflict because people are just beside themselves when they have somebody they love or themselves and feeling like you're not on top of your game. And so can cause the isolation, like I talked about, the use of drugs, missing work or school, or having problems relating to, that setting. And then ultimately leading to financial and legal problems, and then homelessness and poverty. And then wanting to harm yourself, including feeling suicidal, and then possibly even homicidal with some people with mental illness. It tends to weaken our immune system. And so your body has a hard time resisting infections. So there's just so many different things. It's kind of like a snowball effect, what happens. It can lead to other illnesses and lifelong chronic conditions like heart disease and other medical conditions. It can even play a part in diabetes and when your stress levels are high. But looking at how can we prevent these things from happening or get on top of these things, trying to help ourselves or the ones we love to look at how we can control the stress and to increase our ability to function, and maybe looking at low self-esteem and looking at how we can keep these symptoms under control. So in doing that, what is our plan? How are we going to take care of ourselves, and what do we need to do? And, one of the things that I think of because of my medical background and being an RN for 46 years, I've been in the medical field. And so I've served in a lot of different roles as a nurse and worked in mental health and ER and hospital settings and clinic settings and school settings and hospice settings and where babies were born and when people passed on. And so it's given me an insight into just the whole, the whole spectrum of things. But I know that it's so important when we feel like we ourselves or our loved ones are in that suicidal mode or thinking like you want to end your life. And I can be honest with you, I've had that happen to me in my past. And I know that God put some real earthly angels in my path to help me. There were other nurses that I worked with, and I was going through a divorce, and my youngest son suffered sexual abuse by somebody that cared for my kids. I was a single mom, and it was very, very a difficult time in my life, but it taught me a lot. And what it did teach me is the things that I went through and the things I experienced. If I could keep that humbleness that came with those experiences and use it to help me help others, it wasn't all in vain. Again, talking about the suicidal thing, there's lots of different resources out there, and there's a suicidal hotline. There's that are manned 24/7, but there's also in your local communities, there's a crisis response team. Every county and every city has a connection with a crisis response team across the United States, and I know that for a fact because I've utilized it not only for my own family members but for others and in other cities. And so it's so important to seek out and first and foremost, looking at maybe your primary provider who oftentimes knows us very well. And I really tend to lean towards the holistic or natural uh, approach versus piling on a bunch of medications to find out what is causing this, what's leading you to these things, and what's making a difference. Again, in looking at that whole picture, you know, yes, a doctor is a very good place to start, or an integrative medicine doctor, which oftentimes, our insurance, which can be a hindrance for us getting a natural or holistic type of help versus straight medical, our insurance won't cover it. But there are clinics and there are hospitals across the United States and even locally in the northern part of the state. I have seen an integrative health doctor within a medical clinic and a hospital setting. And so I know they're out there. And so it's being your own advocate or being an advocate for your loved ones and making sure that they're getting the right help. Um, Really important when you think about, and I just want to hit again on suicide because I feel like it's such a thing that can sneak up on people, and many times people that are struggling, others don't really realize how extreme it's become for them. And so it's very important for us to be in tune to the warning signs. Um, and if for yourself, if you feel like that's coming on again, to make a plan and have a plan to who you can seek and who are your people that will walk alongside you, making sure that you get in to see a therapist. And I tend to lean towards Christian therapists. I know there's a lot of good mental health providers and therapists and psychologists out there, but I do believe that with that spiritual aspect of things, that is a real component that I believe is very, very helpful and needed. Um, but getting routine medical care and getting help when we need it, and sometimes we're our own worst enemy because we don't want to um, look like we can't deal with life or that we have another problem happening. But taking good care of yourself is so, so important. And, things that we know about, but maybe we don't practice ourselves. Or a loved one isn't practicing, and we can gently um, encourage them. Getting sufficient sleep, eating a healthy diet, and getting regular physical activity are so important. And maintaining kind of a regular schedule and trying to balance your stress and your work and your life and all those things. And seeking the help that you need if you can't seem to manage that. Seeking spiritual counsel from a wise, solid people that are walking in the Christian faith. And that can be a pastor or, like I said, a Christian therapist. So I know that there's a huge part that our diet and our sleep and our exercise, our vitamins that we take and minerals, avoiding chemicals and mood altering things that alter our mood. In addition to other ways that we can make sure that we're doing everything we can to keep our body safe. And one of the things that we wanted to talk about today, recapping, is, just having all those things in place and looking at that, and not letting yourself get too wrapped up in things that you don't take time to take care of yourself and those that you love. Um, I know that when I think of the neurotransmitters, Mary, and I think about how important not only our diet and the exercise and the sleep and the vitamins that we're getting, one of the things that comes to mind is activation. And and that's one of the reasons that I'm on here today too, is to tell everybody that about 3 years ago, 3+ years ago, after going through some heart issues and diabetic diagnosis, and having to have a stent in what they call my widowmaker artery and a pacemaker put in, and struggling with some weight issues and some depression, and certainly after, it's not uncommon after a heart attack to struggle with depression. I started using the Protandim, the activation, and what a difference it's made in my life, um, and how I feel, in my sleep, in my daily activities. But I've also seen it make a difference in my husband's life and my children. I have a daughter who has struggled for years with depression and anxiety, and the inability to function in a fashion that her health and well-being is at risk, and it has changed her life. Um, and she's a person that thinks about the other components, the diet and the exercise and eating properly, but this is just enhanced things, let me put it that way. And so in recapping, I just believe again that your mind, your body, your spirit are so important, to look at all those aspects of your well-being and know that those things are, they work together for your good. And so, and I know that the Lord wants us to be, our bodies are a temple of the Holy Spirit, and He wants us to care for ourselves. But our bodies are designed in such a way, and it's an amazing thing to think about how they're designed and how they work. But there are things that can affect us, and the stress can really, oxidative stress is a big issue in our lives. And so I would really love if Mary could come on and we could talk a little bit about what oxidative stress does and the neurotransmitters, and then recap and then answer some questions or just have some discussion time with everybody. I think that would be great if we could do that. And thank you for my time, giving me your time and allowing me to just kind of glaze over this topic we could talk for hours on. God bless us, each of you, and thank you for listening to me today.
Robin, that was excellent. Thank you so much. I'll just add a couple statements here and then we'll turn it off and go to questions and answers. But the key, what I want to say is that activation is different than supplementation. So when Robin talks about taking an activator, and she listed the name of this activator, what an activation does is actually tells your body to get on the job and make its own antioxidants. And so what is oxidative stress? You talked about that briefly. Oxidative stress is the imbalance between the production of free radicals and the ability of the body to counteract their negative effects by neutralizing them with antioxidants. So if you can imagine, like, a car gets really rusted, it's because it has, all toxins from the air, or all the external things that are making the car rusty, or the apple turn brown if you leave it out on the counter for a while. And so we can take a supplement to, you know, add something to us, or we can take an activator to tell our body to start making its own antioxidants. And we'll get into the details of that in the Q&A time. But it's a game changer as far as health, because there's over 300 mental, emotional sicknesses that can turn to diseases and eventually death due to high oxidative stress. And I find that there's so much hope with this information. I have my own story. Robin has her story. And it's a joy to share this information because it really is life changing. So thank you for this session. I'm going to turn it off and then we'll go to questions and answers.
One other thing I wanted to bring up, Mary,
Oh,
before
yeah,
we
go
turn
ahead.
it off is how important that, taking the supplements, like, the vitamins play a
Oh, yeah, yeah, yeah.
role in our health and well-being. And, you think of the vitamin D, it's called the sunshine vitamin. And oftentimes when we go in to seek maybe medical advice and have things looked at, it's really important for you to ask your provider to check your blood levels on these vitamins. The B vitamins are so critical in the mental health component too. And then the A's, the K's and the E's and the C's are too. And that all just comes together and makes a difference in our well-being. And it truly, truly does affect your mental health. I know when I worked in a youth setting as a nurse that took care of at-risk youth in a jail and foster care and group home setting. One of the things that we found with a lot of these young people is that the vitamin D levels were low, the vitamin B12. And not only that, looking at how the first thing that the psychiatrists or the doctors that were dealing with these youth would pile on these meds, and it happened time and time again. And not only to them, with my patients across the board when I was working in actively in the nursing setting, and my own family and my own self. I mean, that was their first thing that they wanted to do. So be your own advocate, speak out, ask questions, look at other ways that you can help, you guide the path that you're going to take and speak out because it is important before you have all these other things that are added to the mix to find out where you're at medically and with your blood levels. So I just wanted to add that one part of.
That's excellent. I'm
Yeah.
so glad we added that because so many mental health situations are because we are low in, like you said, in these different vitamins and minerals. We're
Yes.
low in our nutrition. We're not eating the right way. We're tired. We're overworked. All of that.
Yes.
And
And
we
yeah.
really have solutions that can turn our mental health around, not only with diet, but with vitamins, yes, but then adding the activation also will tell our body to make its own glutathione, its own superoxide dismutase, its own catalase to the degree that it's designed to do to reduce the oxidative stress and balance out the neurotransmitters. So there really is hope, this
Yes,
process.
definitely.
Yeah. Yeah. So thank you. I'm going to
So,
turn this off and then we'll go to questions and
okay, sounds
answers.
good.
Let's see. Here we go.